there are, of course, different synaptic markers we can test nowadays. Most of them are CSF markers. So we are trying in different labs to use them also in plasma, but the sensitivity and the accuracy in plasma of synaptic markers is still very questioned. So I think at this time it is more important to work always with CSF. And the very interesting markers are neurogranin, SNAP25, which are solid, and there are a lot of different studies performed in different labs showing that both markers are high at the very beginning of Alzheimer's disease. And of interest, they are even higher in Alzheimer's disease compared with other neurodegenerative disorders, which is still not well understood because, of course, if you have a damage, you should expect different synaptic markers in the CSF, but probably the regions which are damaged in Alzheimer's disease are richer of these both biomarkers. And so especially for SNAP25, this was also suggested as a potential diagnostic marker and not only a synaptic marker in general. Then we validated also a new markers, which is called CAP2. So this is a very, very innovative marker. We are working with the lab of Professor Di Luca in Milan, so near in Brescia where we are. We tested this marker with ELISA, so not with other more automatic technique, but we observed again a very clear increase in Alzheimer's disease at different phases, and even higher levels in the early phases compared to advanced phases, which is of interest because it might be also a compensation mechanism. So we are trying to understand why in early phases of the disease, this synaptic marker is relatively high.